From technology and acquisition to citizen services and mission execution, a culture shift is underway with federal government leaders increasingly seeking out solutions that disrupt the way business has traditionally been done. Here we connect with those government and industry leaders driving this change and delivering the real results in support of their agency mission. This is Keeping IT Brief. I'm being joined today by Dr. Himanshu Singh, the Chief Health Informatics Officer at DSS Inc. Thank you for joining me today, Doctor. Let's dive right in. Please tell us about the VA's journey to become a high reliability organization.
So one of the things that I have always admired while I was in the VA and part of the VA, and even when I have since left the VA, is that the VA has been a very transformational organization. It has really embodied change. It has led in change and change management. And what better way is it now that we see VA adopting the high reliable organization journey, right? The HRO journey. So what I'd like to do is kind of briefly reflect on that, because one of the things that I also admire about the VA, that when it does something and it takes on these transformational change, does this in a very smart way. And what I mean by that is, I remember now looking back in my early times when I was getting into leadership into the VA at Charleston when I was the assistant director. We had a great leadership team there. The director, associate director, chief of staff, nurse exec. I mean, collectively valued quality, safety, patient care. And they were big into partnering up with the affiliate and looking at opportunities on, at that time, the VA was on the cusp of value-based care and partnering up with CMS and the payers to start looking at how that would be defined. And that became like the early on, and being part of it and learning that and seeing resemblance of how that was eventually going to be tied not only to quality, safety, and value, but eventually high reliable organization. That really created the foundation for me. So when I went into Ann Arbor and I heard about, wow, VA's looking at, and now we've gone from 2010 to around 2015, that's when VA started to also get early on into the high reliable organization. And there was an opportunity for there to be a pilot site. And I said, oh my God, I raised my hand. Yes, 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 I want that. It was like a kid in a candy store. I was so excited about it. And the medical center director, who was also the acting network director, really was also very much believed in quality, safety, and value. So he said, yeah, let's do this. So we participated in that. And then now I hear that the VA has formalized this process. So what I'm trying to get at is VA started to touch that and pilot it and understand it, and then created a program out of this with policies and process that is now can be easily relatable down to the VISN, the regional level, down to the medical center level, because this journey is really not about just top. It's really organizational. It's down to your EMS workers, to your clinical staff, the clerks, everyone providing or touching directly or indirectly in that patient care and patient journey. So I truly believe, that VA has done this in a smart way and the right way, and I'm excited to see the future of it within the VA.
So what are the 5 principles of HROs and why are they important to the VA?
So let me just talk about the 5 principles. The 5 principles are sensitivity to operations, reluctance to simplify, preoccupations with failure, deference to expertise, and practicing resilience. If you really think about all of those 5 principles, it kind of follows the VA's mission ever since I've known it, which is all tied into quality, safety, and value. And how do you ensure that's happening? Not just in one area, but throughout your organization. What also is between the HRO and the VA and how they have adopted all of this is that there is a shift with renowned focus and accountability, process improvement, patient safety, and organizational involvement, where everyone plays a part and is accountable to that patient's journey, the patient care, tied with patient safety. So overall, it's all about organizational improvement. And VA has been doing this, and now you actually have a formal process. You have a name behind the story that VA has been a part of, which is called High Reliable Organization and the journey behind it. I even remember when I was at the Arbor VA as the associate director, I remember Dr. Petzel. I mean, he had a saying, stop the line, meaning that anyone within that organization, whether you were the CEO, medical center director, associate director, or chief of surgery, or the person who's opening and greeting patients, if you saw anything that can impact patient care or have a negative impact, you raise your hand and you say, stop the line. You make people aware of it. And that was so powerful, and it resonated so well within the VA that it ties into to the whole principle of the HRO. And not only that, the other big thing is, one of the things about preoccupations with failure, which is one of the elements, is, like your example is viewing near misses as opportunities to improve rather than proof of success. What do I mean by that? Every time I remember in morning report, we would look at, what happened, what was the success, what were those near misses. And when we looked at it, we didn't get excited about it saying, oh my God, we had a near miss, but we said, okay, what happened here? What could we have done better? How do we avoid this near miss? And we would look at it from different perspective, and depending on the criticality, we would either create a systems redesign process or process improvement task force that would go in and look at it within that respective service, and then come back with a structured response on how should we change practices or policies to avoid that in the future. So that's an example where we didn't brag about that as a success, but that as an opportunity, and how do we change the culture and the environment. And sometimes it meant changing policy. And if it was really critical and something needed to be done, we would do a root cause analysis. And all of this is documented within the VA governance structure. So if you ever got an audit from Joint Commission or internal VA audits, you can say, hey, this is what we do as an organization. You never have everything perfect, but we're moving towards trying to be as perfect as possible to take care of those veterans that we have the privilege to. So that's just, one or two examples that I could share with you.
Okay, so now can you tell us how intelligent software and data visualization solutions are helping the VA on this journey?
So I think this is an area where I believe the VA continues to be a leader. There's always debate, but I believe it is, and it's within the VA's foundation to be innovate, to be ahead of the industry. If you think about it, a couple of years ago, with the modernization efforts, VA started to create the pillars of innovations. You have identified multiple sites where are the center of innovations, where you've got Shark Tank, great ideas coming out, and then VA creates an environment that they can expand upon it, whether it's telehealth, telecare, and it has been reflective recently, with this COVID pandemic, with COVID and the pandemic, it's really made VA pivot. And to be honest with you, VA was ahead of the commercial healthcare system, because it had those innovative and modernization platform that it had already been working on for the last 8 to 10 years, that it quickly shifted to turn from traditional brick and mortar to that telecare. And that success is shown in multiple recent publications. Even the previous Secretary Wilkie, applauded the VA for its modernization and approach to telecare during the pandemic, and so that we were never losing a beat in taking care of our veterans. Now, as VA is going towards this journey, HRO, it has to continue. We cannot let our guard down. We have to continue to embrace advanced tool with a focus on data analytics, AI, BI, data visualization tools, because that helps predict important trends in clinical practice. And why is that important? Because now, instead of reacting to managing a veteran, we can be proactive. There are a lot of social determinants and different factors that help us better understand a patient population and how to be proactively in managing their healthcare than reacting to it when they're showing up in your ED for inappropriate ED visit, and then hence it could end up being an inappropriate admission. I believe that intuitive information system can help healthcare providers, really access real-time data. I think that's important, to have information real time in front of you. And then if you can tie in the analytics and AI tools, which can help proactively predict the right care for our veterans. And what do I mean by that? So let's say you have, as a physician or a nurse or that healthcare provider, you have 20 or 30 patients you're going to see today. If you had a tool that can say, X percentage of the veterans really need one-on-one care, where because they have multiple chronic conditions, they really are always coming through your ED system, whatever those predictive analytics that help drive that, right? Their comorbidity. But you know what? There's this percentage of patients that are really compliant. They do a really good job. And you know what? They don't need to come in for a face-to-face. You can take care of them through telecare. How powerful is that? Now you can really concentrate face-to-face with those patients that really need it and provide them that level of care. And the others you manage through telecare or phone care or as necessary within the different modalities that is allowed in front of you. So that's another example I wanted to give, the power of having these analytics and intelligent software. And to be honest with you, this is the future of healthcare, bringing human minds with intuitive information system and hence providing predictive and precision medicine. I think this is and will continue to be needed within our, not just the VA, but overall healthcare system in providing outstanding care to our veterans. One of the things I also want to tie in real quick, if I have a minute here, is that when I left the VA, I loved innovation, and I joined the VA as a chief health informatics officer back in 2000. So when I left the VA to be doing this for a healthcare technology company, DSS, I came in with the mindset, what are we doing to proactively, how are our platforms proactively helping patient care? How are we creating a value propositions for our customers that tied in to making their life easier and helping in taking care of our veterans? So one of my mission has been, really mapping and gapping the patient's journey, and then tying in during the patient's journey, where does each platform tie into, each product tie into that patient's journey, and then to take that 2 or 3 steps higher. How is each one of those products, as they're tying into that patient journey, what is the value proposition from a high reliable organization, from value-based care, from quality, safety, and value, really bringing all that together, because now we have created a pathway for our customers, for our VA customers who are blessed with taking care of our veterans. Now they can see and tie in how that platform not only makes their job easier, but is tied into that modernization efforts, how it's tied into predictive information system. We have now all of our products is tied to that at DSS. One is, comprehensive care coordination, which really looks at a patients from that 2 or 3 days before discharge, all the way to discharge, to the outpatient care, to home care, to telecare, in helping our the clinical care provider proactively manage that patient. So I just want to end with that statement I said earlier. This is the future of healthcare, bringing human minds with the intuitive information system, providing predictive and precision medicine, in providing outstanding care to our veterans.
Oh, great information. Thank you so much for joining me today, Doctor.
Thank you so much. Have a blessed day.
Thank you for listening. For more podcasts by G2 Exchange Media, please visit www.vethealthit.com and look for the podcast section at the top of the page. Music by Jam Studio, courtesy of Shutterstock Incorporated.